Welcome to FuncPhysio Healthy Mommy Room, and thank you for participating today. This series is for patient or client who like to know about a physical change and during pregnancy and who like to minimize the risk of injuries. I would expect to have series of maybe 7 to 8 module followed by professional module. So this 7 to 8 module is for patient education. You're welcome to participate as a profession to educate patient, but we'll have like professional module after this. And after this module, we have a Q&A session after the presentation. So you can put a question in the chat section during presentation. Nidhi and myself or Amy might able to answer after the session. Let me introduce presenter, Dr. Nidhi Sharma today. Nidhi is the
Hi.
one, hello. Nidhi is the one, the board certified clinical specialist in women's health, so which is kind of rare certification. So she has a lot of experience and knowledge and skill in this field. So shall we, Nidhi?
Yeah, sure. Um, my name is Nidhi. I am a women's health physical therapist. I have been practicing for almost 12 years. I mostly see postpartum pregnant women, postpartum who are trying to get pregnant, and also women who have, or men who have pelvic pain or other pelvic health issues. So this is a series of, like Yohei said, 7 or 8 modules. This is the first one. Here I'm going to just sort of set a lot of baseline for upcoming modules, and I'll give you a nice overview of why so many things change in pregnancy and how they are related to each other. And you can always type the questions in for me and I will answer in the end, right, Yohei? So
Yeah, you
I'm
can
going
type
to
it in the
share.
chat section, and then we may or may not answer at that point. We will save it to the later, but you can you can type the question into the chat section.
All right, so I'm going to share my screen here. All right. Okay. All right, so we're going to start from here. How does pregnancy change your body? One of the things that most people don't realize is that changes of pregnancy really start very early. They start in the first trimester, they start in the first, second week of gestation, after you find out you're pregnant. And at that time nothing shows, right? You're not showing pregnancy, you may not even know that you're pregnant, but the changes have started, and that's why it's important to learn about these changes, because they're not always obvious. You're not going to always see them in your body until second or third trimester. They will affect all systems of the body, including digestion, circulation, respiration, posture, joint. And I'll touch on all of them a little bit, but our focus is definitely a lot more on musculoskeletal posture, muscles, ligaments. Most of these changes are driven by hormones. Hormones are unique chemicals in our body that affect, again, the entire body. And these hormones really change during pregnancy. And understanding a little bit about these hormones can help us understand why are these changes happening, and again, when to expect each change to happen. All those changes are so unique and so widespread. One good thing is that they do follow a pattern. They do follow a pattern from 1 week to next, or from 1 month to next. So if you're understanding the changes and you know what's coming, or you know what's coming in the pregnancy for your client, you may be able to foresee that challenge, right? You may be able to see that, okay, towards the end of second trimester this may happen, and I should look out for it and I should prepare for it. So, hormones of pregnancy. The first important hormone that we're going to discuss is relaxin. Relaxin is a hormone that's produced by ovary and placenta. What relaxin does is basically make space in your body. Okay, it's going to stretch out and loosen a lot of tissue in the body, and basically make a body a little more flexible, because now obviously you have to accommodate a baby, and you have to accommodate a growing baby. It relaxes the ligaments in the pelvis and other parts of the body. So if you look at this picture here, this is a pelvis, and you see this white tissue around different parts of the pelvis, usually between two bones. That tissue is ligament. Ligament, think of it as a rope, like a thick rope. It's usually between two bones, and its function is to stabilize that joint, to basically keep it together, give it a little more stability. All of these ligaments, not just pelvis, your shoulder, your neck, your back, your knee, all of these ligaments will loosen up, okay? And as they loosen up, these bones can move more. They can spread apart. And that's what makes this pelvis wider, and it's able to accommodate that much more weight and that much more volume as the baby grows. It also softens and widens the cervix, again, helping in the delivery. Important thing to know about relaxin is it starts increasing in first trimester. Okay, so first trimester, you haven't gained any weight. You don't really look any different yet. But it has started increasing. And it really reaches its high point in second trimester. Again, most people haven't gained a lot of weight by 12, 14, or 16 weeks. And what that translates into is relaxin, because it makes the ligaments looser, it increases the demand on your muscles. So between these two bones, there's a ligament, and there's also muscles. When the bones move, when the joints move, they are stabilized by the muscles and the ligaments. And now that the ligaments are looser, the muscles have to work that much harder. So that's one of the implications that we find, is that muscles have to work harder. And if they cannot, if they don't have enough buffer or enough strength to do that, then you get pain, or you might get pain. So important part here is this pain may start much before you gain any weight. Okay, so I see women in my clinic typically around 15, 16 weeks, under 20 weeks, and they have so much pain in their buttock or back. And it's not necessarily because they have more weight just yet. It's because the relaxin is already there. It's already making the ligaments looser, and it's increasing the demand on the muscles. So that can happen usually in second trimester, but can happen in first also. The second hormone is progesterone. Progesterone will also increase the flexibility of all the tissues. Relaxin had a lot more focus on the ligaments, but progesterone has a focus on skin, on muscles, on smooth muscles, skeletal muscles, smooth muscles, basically muscles of your uterus, your intestines, like the muscles that you don't have any control over, basically, organs. And then the skeletal muscles like biceps, triceps, quadriceps, all of those muscles will start to loosen up. And as the muscles soften and loosen, again, they lose a little bit of their strength. They lose a little bit of their tone and function. They slow down a little bit. So when the muscles of bladder slow down, you see it as retention. So you may not pee as often as you did before. Not in the later in the pregnancy, very early in the pregnancy. You may be peeing less often because your bladder has relaxed, and that sometimes predisposes women to urinary tract infections during this time. Stomach will loosen up, and that can give you gastric reflux or indigestion. Same way, the intestines will loosen up, and that will slow down the digestive process and can give you constipation. So all the organs inside, again, very early, first trimester, second trimester, nothing, no weight gain has happened, and all these things can already happen due to effect of hormones. Finally, it will also reinforce the effect of relaxin and causes more laxity or looseness in the joints. So now the joints are a little bit loose, ligaments are a little bit loose, muscles are a little bit softer. So you can see how each and every joint, not just pelvis or back, has a little more control issues, has a little more work to do to keep things stable. And that's why in pregnancy, we see a lot of pain even before the weight gain happens, even before all the changes, big changes of pregnancy come along. in third trimester. Third hormone is estrogen. Estrogen basically supports whatever else progesterone was doing. And fourth important hormone is oxytocin. Oxytocin is called the motherhood hormone sometimes. It's the one that starts the process of childbirth, labor, and helps in uterine contraction. It also helps in improving mood of the mothers, and it also improves in lactation. So now I'm going to focus a little bit on the pelvis, because pelvis is our biggest concern, biggest area where the changes happen. Remember, all these changes happen in all joints. So we're going to talk about knee pain and shoulder pain and other pains later on. But I'm going to focus on pelvis in this one because pelvis is where most changes will happen, and at least changes will show up most. Okay. So this is pelvis in the body. You can see in the big picture. Pelvis is sort of a ring. Okay, it's made up of 3 bones. There's a bone on the left, there's a bone on the right, there's a bone in the back. And you can see there's like a ring forming. The entire pelvis ring has a base. Think of it as a floor. So same picture here, bone on the left, bone on the right, bone in the back, and there is the muscle inside. The muscle inside, as you can see, this red thing is forming like a floor inside the pelvis. And that floor is called pelvic floor. All of these muscles together are called pelvic floor. Pelvic floor is forming the floor of pelvis. So everything that is inside the pelvis is supported by pelvic floor, because obviously it's the floor of that region. So let me show you what the pelvis looks like from the side. Here's the side view. So if you were to cut in the middle and we're looking from inside, there's the backbone in the back, there's a bone in the front. This will be bladder, where you collect your pee. This would be uterus, where the baby is. This is the rectum, where you collect the poop. And all these organs are living inside this pelvis. This big sling here will be the pelvic floor. And you can see in the ideal, in normal situation, these organs have a little bit of gap between them. They're not running into each other. They're not affected a lot by each other. And what happens with pregnancy is this uterus is going to grow. It's going to grow more than 500 times its original size. Okay. When it grows 500 times its original size, it starts to grow out of the pelvic cavity and into the abdomen. And this is the picture, right? So it's going to grow. This was the pelvis. This is the bladder. This is the rectum. This is the uterus. And then the uterus starts to grow up and out of the pelvis and really encroaches into everything above the pelvis, into the abdominal cavity. Because it was next to these 2 organs, and again, in normal situation, it wasn't touching or affecting other organs. Now it will start to affect. You can see this baby is gonna has the ability to push on the bladder a little bit. So it can push the bladder down. It can make you pee more often. It can actually push the bladder down. So you may feel the bladder coming through the vaginal opening a little bit. It can push the rectum down, which may give you constipation, or it may give you urgency of bowel movement also. The pelvic floor that was underneath here, as the uterus grows and pushes on everything, this pelvic floor needs to stretch. It stretches and stretches and stretches. Instead of looking like a sling, by the end of pregnancy, it looks more like a bowl. It looks like a nice deep bowl in here. And that stretch of the pelvic floor, what will that do is it can weaken the pelvic floor and weaken the function of pelvic floor. So let's go back to what the function of pelvic floor is. This pelvic floor has 3 openings in it. It has urethra, where you pee from, vagina, where the baby comes out from, and then the anal opening where you poop from. These 3 openings are openings inside the pelvic floor. When the pelvic floor contracts, it closes these openings. When it relaxes, it opens these openings. So the closure of these openings is at least somewhat dependent on this muscle. When this muscle stretches out and is under all that pressure from the uterus and other organs, it sometimes isn't able to close these openings as efficiently as it should. And that might lead to leaking, constipation, retention of urine, like you're trying to pee and you can't get the pee out. So many other problems that come with the pelvic floor can happen here. Okay, so that's the same picture. We already said that pressure on the bladder here can cause frequent peeing. Pressure on the rectum here in the back can cause constipation. Now, again, we see this baby has moved out of the pelvic cavity into the abdomen. What that means is now the baby has all this weight pulling on the spine. This is the spine. And if you see in the other picture, the uterus and all the organs are fairly low. They don't have a whole lot of effect on the spine. This is the lower part of the spine. This is not lower back. Lower back starts somewhere here, and all of these organs don't have a lot to do, don't have a lot of weight on the spine. And that changes during pregnancy. Now the baby is out here, and these are the lower back bones. And they have a whole lot of weight to take. So baby pulls forward and increases tension on these bones and these muscles. And that's one of the reasons the posture changes. That's one of the reasons the lower back pain happens in pregnancy. So there's pull on tension, lower back pain that can cause pain. Stretching of pelvic floor can cause leaking. I explained that. And then all the organs near the uterus and far from uterus will be affected. There will be pressure on the lungs. There will be pressure on the diaphragm. There will be pressure on the intestines. There will be pressure on the liver. So everything undergoes pressure, and everything gets a little bit slower and a little bit more inefficient. So here's the big picture of the pelvic floor. You can see it looks like a sling. It goes from front to back. This is the other picture we already saw. If this sling, instead of looking like this, it was to look like this, lower, it would have less ability to do what it's doing. It will lose its tension, so it will lose some of its strength. Most common time for the incontinence, the leaking to start in pregnancy is around 30 weeks. Okay, in around 30 weeks, you have started gaining weight pretty significantly, and the hormones are at a high, everything is loosening. So almost half the women will report their leaking first time around 28, 30 weeks. And up to 80% of women will report leaking if they are having a baby the second or third time. So it's really more common than most women realize. And it starts around then. Around then, it's not necessarily because the baby is pushing on the bladder, because that's what a lot of women think, that baby is sitting on my bladder, pushing down. You're not that far along just yet, that baby is pushing on the bladder all the time, but your pelvic floor has stretched a lot. So at this point, strengthening pelvic floor, even before this, strengthening pelvic floor is important and can decrease the symptoms of leaking. And now let's go to back pain and why back pain and leg pain happens during pregnancy. So this is a pregnant woman here. And this is what we call as line of gravity. So if we were to drop a plumb line, it goes through different structures in the body. This line describes where most of the weight is being taken in your body, in your spine, in your legs, in your hips. This is where the baby is. So what happens during pregnancy is, because the baby is here, baby is gonna pull the spine forward. We already saw that picture earlier. When the baby tends to pull the spine forward, what you do is you take your upper back or your middle back and you lean back. Because if this was uncontrolled, if you didn't lean back, you would fall over, basically. So trying to not fall over, trying to stay upright, what most pregnant women will do is try to balance this pull forward by leaning back. So we'll see this increased arch in most pregnant women. And after this increased arch, we also see an increased rounding of their back. So this increased arch causes lower back pain, can cause pelvic pain, pelvic girdle pain, and then the rounding of your upper back can cause upper back pain, neck pain, tingling, numbness in the arms, and all the nerves that come out of here get irritated. So when we talk about correcting posture for pregnancy, we're not just going to correct the pelvis. We're also going to correct the upper back and the neck, because really everything that's happening from the neck, from the upper back, from the lower back is connected. It's a one chain of spine that's going from here to here, and we're going to try to correct all of them at least a little bit. Practitioners who are treating neck pain, if you're trying to correct just their neck or upper back pain, you try to tell women just pull your shoulders back, it's not going to work, because if she has this much arch in her back, there is no way she's going to pull her shoulders back, because she will fall forward. She's trying to do that, trying to maintain the balance with her increasing weight in the belly. So most of the changes that happen in posture, most of the correction that you do in the posture has to happen from pelvis onwards. All right. So posture is one reason why you can get back pain. The second is laxity. We already talked about the ligaments getting looser. So one, there is weight that's pulling the spine forward. Two, the ligaments that were keeping the spine stable, so little tiny ropes between the bones of the spine and the pelvis, are all looser. So something is pulling you forward and you also lose. So you go forward more easily. So that laxity, that looseness increases the demand on the muscles even more. And third cause is the abdominal muscle stretching. I'll go over this in a much more detail and then in a future module, because this is one of the major problems that women have. But what happens sometime during pregnancy is the muscles, all muscles of your belly will stretch out, okay, under the effect of progesterone. So everything will stretch out, trying to make space for the baby. And as we're trying to make space for the baby, most of the time, the muscle, that is a six-pack muscle, the tissue between this six-pack muscle will split apart. It will stretch out enough that you can see a gap between the two sides of this muscle. That is called diastasis recti, or abdominal muscle separation. And again, after this separation, you don't have as much strength of those muscles as you did. And we all know that abdominal strength is important for lower back pain. So when you lose that abdominal strength, it's harder for you to stabilize your back. And you need to strengthen these abdominal muscles during pregnancy to help this back pain. This problem can persist after giving birth, and there are things we can do to help that. And I'll go over that in a future module. So this is a typical pregnancy posture, okay? I am pregnant. I think I'm 24 weeks here, 22. This is my colleague. I think, 34 weeks pregnant in this picture. And you can see the posture changes, even though she has more and I have less, are very similar. Okay, so it's not necessarily because the weight has increased. It's also because the ligaments are loose, and we're both trying to find a center of gravity. We're trying to find a balance. So you'll see an increased arch. You see that in me too. You'll see the pelvis tilts forward. So the back of the pelvic bone and the front of the pelvic bone should really be parallel. I'm going to show you another picture. It should look something like this. And then in pregnancy, it looks something like this. Okay, so the pelvis tilts forward. The upper back, you're going to lean back, so you get this arch in your back. And then you have the breastbone or the chest bone sticks up. So you kind of stand like in a military posture. You're trying to be upright. You're thinking that you're upright, at least. And in that, you have this tilt going up. So the pelvis is tilting down, the rib cage is tilting up, you have this arch in your back. These are three main changes. Typically, we'll also see the knees are locked, and knees are locked because you're trying to decrease the work on the muscles. You're just trying to lock the joints so you can stand there by just using the joint mechanism rather than using the muscles. And then feet are a little bit flat. We don't show it here, but usually the feet are turned out a little bit. So instead of like this, the feet will look like this. And then your feet come apart more and more. I'm showing that here, my feet are apart. And the arches will flatten. So we don't have to worry about all of those just yet. Let's focus on four things that are most important. The knees are locked, the pelvis is tilting forward, there's a huge arch, and then the rib cage is tilting back. So how do we correct all of those things? And correcting all of those things is necessary. It's not necessary just for lower back pain, it's necessary for upper back pain. Like I said, whether you treat neck pain or you treat foot pain, you have to correct the pelvis. It's not going to work without that, because pelvis is where the changes are driven from. You have to correct that. So how do we correct it? This is my posture without correction, and you can see my belly is out a little bit. And this is with knee correction. Obviously, the goal is not to not let the belly show. That's not what I'm trying to do. But you see this arch in my back, and you see a little less arch in my back here once I correct. You see my knees are locked, and you see my knees are not locked in this one. Okay, so we want to get to as much of a neutral position as we can. And of course, I'm showing a very good job here because I'm not that much pregnant, 21 weeks maybe. If you are much more pregnant than me, you will see much different changes. Okay, so postural correction. I'm going to play this video a few times, okay, but we're going to notice four more significant changes. I'm going to soften my knees first. I'm going to take the weight off my heels and put them in my arches. If you're pregnant, you can try this now that I'm doing it, explaining this. So when you stand straight, you feel that your weight is in your heels. You mostly take your weight in your heels. Your knees are locked and your back is arched. So first you're going to unlock your knees. Okay, don't bend them, just soften your knees. You're going to shift your weight from your heels to your arches. So come forward a little bit. Then you're going to roll your pelvis back. Okay, rolling your pelvis back. Think of making your tailbone a little bit longer. So think of reaching this bone down to the floor. So make your tailbone a little bit longer. Then we're going to put our hands on the breastbone and we're going to pull it down. So I'm going to pause it in the middle, just so you see. All right, softening your knees, shifting the weight. Then I take my pelvis, make my tailbone longer. Then I'm going to put my hands on my breastbone, because remember I said the breastbone kind of points up in pregnancy. So I'm going to put my hands on my breastbone and then basically just pull it down. My hands are going to pull my breastbone straight down to my feet. Okay, not a whole lot. So think of it as you pull down maybe 3 centimeters or less. Okay. I'm going to pull my breastbone down and then I'm gently going to tuck my chin in. In this position, you can see the arch is less, the knees are not locked. You are going to feel like you are leaning forward. That's normal. You're going to feel, oh my God, I'm so far forward, I'm going to fall over. And that's not because you're going to fall over. That's because you're so used to being in that other posture, your body has to get used to it. Especially if you're in your third trimester and there's so much weight in the front. So if you are doing this in first trimester or second, it may be easy. In third, you may not get to this perfect position, okay? But try this 7 times, 8 times in a day and just try to hold it, okay? You're not going to get to that perfect position that I'm showing, but hopefully you won't keep going into the other direction unchecked, right? That makes sense. So we don't want, even if you can get 100% correction, I don't want you to end up in a 0% correction by end of pregnancy. So if we can correct somewhere around 50% in third trimester, I'm happy. This position also gives you ability a little more. Once you are in this position, you will feel like you have a little more ability to engage your abs. You will feel that there's some weight in your quads, in your thigh muscles. There's some weight in your feet muscles, like your arch muscles. So arch muscles, thigh muscles, glutes, abs, these are all the muscles that should work to keep you upright. And once you go back to the other posture, here you'll feel there's no work. Okay, your knees are locked. You may feel that they're in the back of your knees, there's a tension. The back of your heel, there's a tension, and there's the lower back. So you are depending on ligaments. You're depending on joints. You're locking this joint, you're locking this joint, you're locking this joint to stand, not using any muscles. And by the time you get here, you will feel that you have to use this muscle, this muscle, this muscle. And obviously those muscles are weakening, so it's harder to hold that. But stick with it. Stick with it. Do it 4, 5, 6, 7 times in the day. Correct it and see how it feels. Look in the mirror how it feels and keep doing it. It will prevent pain. And if there is pain, it can help that pain, your back pain, your pelvic pain. It will also give you more chances to use these muscles once you give birth. After you give birth, you have no weight. And I still see this posture in moms all the time. All the time. If you are a mom, you already know that you have this posture, you hold the baby and you put the baby in the front on your pelvis, right? You are living in this posture way after giving birth. And if you keep practicing, my hope is that even if you have this posture, you won't live in it by after giving birth. You will be able to get back to this pretty soon. Okay, so, and you're not walking like this. This is not walking posture. This is mostly for practicing when you stand. Another way, if you're very pregnant, is to lean on the wall. So if you lean on the wall, or if there's a wall in front of you, then you won't have that fear that you'll fall. You can widen your knee a little bit more, your feet a little bit more. That might give you a little more sense of stability. And this is all for women who are further along the pregnancy, 37, 38 weeks, 35 weeks, who will say, I can't be forward, I feel like I'll fall. So if you feel like balance is a challenge, lean against the wall and do less. Doing less is better than not doing. Okay, so how do I get this? Some general changes. There is increase in respiration. So you need a lot more air in your lungs. I think 40% more air in, no, I'm sorry, 10%. 10% more air in your body than you did pre-pregnancy, because now a lot of oxygen is also going to your baby. So lungs have to work harder. And while they work harder, each and every breath you take is a little bit deeper. Okay, so you might have the feeling of breathing heavy. Doesn't mean you're short of breath. It just means that you will have that feeling of breathing heavy. So if you're a trainer and training pregnant women, you will feel them like you can hear their breath a little bit more. You also have increased volume to pump in your body. So you have 40% more blood than you did before. Okay, if you had 3 to 4 liters of blood to pump now, you will have 6 to 7. Okay, that's 50%, 40% more. And of course, your body has to pump that blood. So more you move, better it is. And it may cause swelling in your legs and feet. The baseline body temperature is increased. So your baseline temperature is at least half a degree more than it was pre-pregnancy without doing anything, without working out, without doing anything. You're just a little bit warmer now, which means that if you are working out, you're going outside in heat, in humid temperatures and hot temperatures, you are at a risk of overheating. So you should take breaks, you should drink a lot of water, you should make sure that you're not getting too hot. Being too hot was okay before pregnancy. Being too hot now is not okay. Okay, you have an increased risk of dehydration. There's slight increase in the risk of osteoporosis that sometimes in some women, and this is rare, in some women in third trimester, as the baby is gaining more calcium and strengthening his or her bones, they tend to take that calcium from the mom's bones. So sometimes there is a risk of weakening of bones. Again, it's rare. The symptom would be pain in the hip, pain in the pelvis, pain in the back. By far, most common reason for these pains is muscles, ligaments, and other things. Very rarely, it can be weakening of bones. And a physical therapist will be able to rule that out or work with your doctor. Finally, blood pressure is lower than pre-pregnancy. Your blood pressure is going to stay low because progesterone has made all your blood vessels a little bit looser. It can cause dizziness, it can cause lightheadedness, and something that trainers and women should be aware of. All right, I think that's it. Thank you. And I am going to stop the screen sharing and see if I can go back.
Thank you, Nidhi.
Hi, I'm trying to exit this thing.
I think you have to just stop sharing.
Where is, oh, there it is. Okay. Okay,
Yeah,
yes.
Yeah, thank you very much. And then we have a couple questions. And do you want to go over a little bit the next module, like what you're going to talk about it?
Yes.
I think Amy's coming.
So next module will be lower back pain, pelvic pain, and hip pain. So the pain in the front of the pelvis, round ligament pain is a common terminology most women have heard. The pain in the groin, pain in the hip, pain in the legs a little bit. And again, we'll go over a little bit more detail of how pelvis can change those pains and why those pains happen. And in each module from now on that we're more focused, I'm going to show some exercises to correct that. So you can either, practice it with me when I'm showing you, or watch it and try it later. So next one is pelvic pain and hip pain.
Right, thank you. Amy here?
Yep. So we have questions from participants, Nidhi. So the first question is, this person is 7 weeks pregnant. She used to be a dancer, very active, and she's been working out to basically keep her body in shape. And she's wondering whether she should stop or continue exercising as her pregnancy goes on.
So she should definitely keep exercising. I mean, the question is a little bit, I probably needed more details on what she's doing. But generally, if you have been exercising before pregnancy, it's completely safe to do so, continuing to do so after pregnancy. If she already has a OBGYN, she can get clearance from them. But an uncomplicated pregnancy, it's totally fine. You don't want to do an exercise that challenges your heart rate to the maximum. So if you are training, if you're an athlete and training with heart rate monitoring, we don't want you to train at a maximum heart rate. But that's pretty much the only restriction that early in the pregnancy.
Okay, thank you. The next question, I think, comes from the healthcare profession. And she or he heard most of the pelvic pain would go away after pregnancy. And he's wondering what you think about it as a women's health specialist, about the pelvic pain in general.
Will it go away?
Right.
So pelvic pain, I'm guessing this is pelvic, like pain around the pelvis, not inside the pelvis. The pain it's not that it'll go away just by itself or if we don't do anything. Typically will decrease after pregnancy, but it will go away if you do all the right things. So if you go to PT, if you need to go to PT, if you've been watching your posture throughout the pregnancy, if you do the exercises, so all the things that you're supposed to do, we are educating you on, you do them. And if this pain persists, you go to PT. Yes, the pain will go away, will be managed.
Okay. The next question is, should you start doing certain exercises before pregnancy to reduce risk of having issues postpartum? And also, at what point after giving birth should you start exercising, and what type of exercises do you recommend?
Can you repeat the first part?
All right. So should you start doing certain exercises before pregnancy to reduce the risk of having issues after pregnancy?
So every exercise we're going to talk about in the modules coming up, you should start before pregnancy, because pregnancy is a time where it's hard to keep a perfect posture. Body is going through changes and hard to do the things that I'm telling you. So if you know you're going to get pregnant in the next few months, it's definitely a good idea to start doing these things now. It's also very important that you are active, you are working out, doing cardio 2-3 times a week. Going into the pregnancy, you want to be at a healthy weight and at a healthy cardiovascular point in the life before pregnancy. That's good. What was the second part?
The second one was, at what point after giving birth should you start exercising, and what type of exercises do you recommend?
So within first 4 weeks, the gentle engaging of the core muscles is important. So again, as we go through the modules, we'll talk about what exercises are good coming right after delivery. I have a module on 4th trimester, which is right after giving birth. So that time we want to engage the abdominals, we want to gently engage the pelvic floor, we want to connect with the breath to see we can all engage all of those muscles together. These are not big movements. These are just, okay, let's start activating these muscles again. And that's for first, 3-4 weeks. You should also monitor your posture. You should learn how to lift your baby, how to carry your baby, because even if you're not exercising, you are likely carrying your baby all the time. After 4 to 6 weeks, after you're cleared by the doctor, you can return to more higher level exercises where you directly work on the pelvic floor to engage the pelvic floor. It really also depends on the person, like what kind of delivery did they have? Was there trauma in the delivery? If there's no trauma, first few weeks are totally safe to work on mechanics, how to lift, how to carry, how to stand, engaging all the muscles, even doing a little bit of strengthening with the leg muscles. And after 6 weeks, we get a little more directly focused on the pelvic floor, Kegels and other exercises.
Good. So this is also from a healthcare profession, and I know strengthening transverse abdominis and pelvic floor muscles is very important during pregnancy or after pregnancy, but it's difficult to know whether or not you're engaging them correctly. And what are some good ways to assess them or have patients perform these exercises to strengthen those muscles correctly?
Okay, so most people here probably don't know the transverse abdominis muscle just yet because we haven't talked about it, and that's going to come in next module. So transverse abdominis is the abdominal muscles, one of the muscles that's important for helping the diastasis. Once we teach as a practitioner, we're teaching a patient how to engage these muscles, transverse abdominis, pelvic floor. And if we have made sure that they can actually contract these muscles easily or properly, then we want to practice them enough in our online session or clinic session in different position. We want to do it in standing, in sitting, in all fours, lying down, lifting, carrying, in so many places that patient internally feels what that feel like. Like I'm going to feel with my hands if their muscle is contracting. Patients should not need to feel by themselves. They should just feel in their body that they're contracting. Yeah. So they should have a kinesthetic sense. If I think that word will make sense to the practitioner, they should have a kinesthetic sense of the engagement of those muscles. They shouldn't have to touch those muscles. If we have done a good job, practicing in different positions with different breathing techniques, may take a session or two, but patients should be able to feel those muscles contract in their body without having to touch them.
All right. Another question is, what are some recommended anatomy or physiology books to learn about women's health?
Like pregnancy in general?
I think it can be in general about anatomy, physio. What which book do you use?
I guess
as
it
a
depends on
resource?
what they're trying to do. So for diastasis recti, which is the most common complaint, Diane Lee's book is great. Split in the middle, I think is the name. Anything by Diane Lee is great in terms of pregnancy and changes around pregnancy. Women's health issues, I think, is the name of the book by Irion, Irion, is great. I think those two come to my mind.
Okay,
most.
That's good to know. Let me open up. What kind of activities should be avoided during pregnancy? I know this is
yeah, this is a little weak. Right. So again, answering for uncomplicated pregnancy, right? So let's assume there's no diabetes, no blood pressure issues, nothing is going on. We don't want to work out at the maximum heart rate. So if you are monitoring your workout by heart rate, and you want to, usually, athletes and trainers, they often monitor their heart rate, your ideal heart rate, and you get there and you try to stay there. Heart rate is not a good measure during pregnancy because your baseline heart rate increases. So you may get to that heart rate with much quicker work and you may not realize how your body is feeling. So heart rate is not a good measure. So maximum heart rate is probably not the thing you're going to do. You don't want to work out for extended periods of time in hot or humid temperature. So if you're not going to run a half marathon in a 100-degree day, okay, that may not be safe. Lifting, I have, there are different views. How can you lift your maximum? Like if you're a weightlifter, can you lift your maximum PR? Most people will say probably avoid that. That's the ACOG guideline. If you're going to lift the maximum amount, get a clearance from your doctor. Okay. We typically say your maximum load, if you lift, let's say 300 pounds maximum, I would cut that by 25%, to be safe. And if you want to go above that, get a clearance from the doctor. You don't want to do any activity, and that should be on trainer's mind. You don't want to do any activity where you're sure or you think the patient is bearing down. So if the only way they can lift that heavy is bearing down, holding their breath and bearing down into the pelvic floor is already stretching. Pelvic floor is already undergoing these changing and getting all that downward pressure. So we don't want that much more downward pressure. So modifying the activities where downward pressure or bearing down is a habit. Trying to think if there's anything else. Yeah, I mean, activities, you're not going to do anything if you're further along the pregnancy laying on your stomach. That kind of thing is obvious.
All right, thank you. And I think Yohei has questions.
Okay, let's see.
In the chat section.
Yes, I see it. How much we should spend time for exercises during pregnancy, especially if we cannot go out in current situation, tend to decrease the physical activity level. Yes, I am going through this right now. I am So again, American College of Gynecology recommendation is every uncomplicated pregnancy, they want women to exercise at a low to moderate intensity just about every day. Okay, so 5 to 7 days. So I go out every day, and low to moderate intensity here is that my heart rate, my exertion is enough that I can say a short sentence. So, but I can't have this talk. So it's not like strolling in a park for an hour. You should walk a little bit faster, like a brisk walk, or you can do elliptical or other things if you have at home. So you want to increase your exertion level to that much for half an hour every day. just about. Again, if you feel well enough. Strength training twice a week. So, and again, strength training doesn't have to be lifting weights over your head. Doing simple squats, lunges, like using your body weight is strength training, right? Bridges, doing clamshells, doing other exercises with little bands in your arms. All of that is strength training. So you want to do strength training twice a week. Again, and last, again, ACOG recommendation is if you are doing high intensity work, high intensity interval training, 1 to 2 times a week. If you want to do more than that, you should get clearance from the doctor.
Okay.
Does that answer the question, Yue? Now, how much time should we spend? Yeah, half an hour to 40 minutes every day, and then twice a week, sometime, you're going to add half an hour of actual strength work.
Yeah, thank you. Any type of exercise you recommend inside of the house?
So yoga is a good one. If you have, a yoga trainer or a program that you're following, yoga is a good one. You can also do, I like dancing, so I'll pick up a bar class. Bar class are usually fine because you're standing up. You can follow any aerobic session online, YouTube. There are tons of trainers who are working with pregnant women right now. If you have access, I have an access to a trail where I can walk uphill. So I walk uphill a little bit. Yeah.
Thank you very much.
I mean, there were other things that, women were doing, Pilates. So if it's not Pilates, you can still do that. Just make sure that the trainer you're working with has experience working with pregnant women, that they're doing things that are safe.
Right. Thank you very much. If there are any question, we'll take, and if not, we'll close up. And thank you for participating. And we'll have this module in, I think, every week and at the same time. So Wednesday, New York time, it's 9 a.m. If you're in Japan, that's 10 p.m. On Wednesday. And I think we're going to use the same ID for you, this Zoom meeting. So if you have already this Zoom ID, you can re-log in the same account.
Oh,
makes sense.
Yes.
Right. So yeah, thank you, Nidhi, and thank you for
everyone.
And we'll have a good day, and then we'll see you next time.
Right. See you next week. Bye. Thank you.